Hey guys, I am back with another quick video on coronary arteries and specifically the areas of the heart that they'll supply, each of them individually. So let's get right into this. Here's just a general diagram of the anterior part of the heart, and it looks like the heart's been kind of cut open so we can see what's going on. So to begin here, I want to just kind of take you through how blood moves through the heart so you can get a general understanding of the different areas of the heart before we move into the vessels that supply each section of the heart. So we have blood that's coming from the superior vena cava, or the venous system, and it's returning back to the heart. Okay? And I want to use a different color here for this specifically because this blood is venous blood, and venous blood is very low in oxygen. So it's just gotten back from going through the whole body and supplying the different areas of the body. And so all the oxygen's been sapped out of the blood. So blood enters in and it goes into the first section of the heart, which is the right atrium. Okay, so this is the right atrium. And then from the right atrium, it goes through the valve right here, the tricuspid valve. And it goes through the valve, it enters into the right ventricle. And then from the right ventricle, it goes through the pulmonic valve, up through the pulmonary arteries. So the pulmonary arteries, it can go either side to supply, to go to the lungs, and then the lungs will bring back this blood that is now oxygenated, coming back to the pulmonary vein. So let me switch the color right here. So now we have oxygenated blood that's going to come back into the left atrium. So this is the left atrium. And it's going to go through the mitral valve, okay? And it's going to enter into the left ventricle. And then the left ventricle is the primary pumping area of the heart. And the left ventricle is going to send the blood through the aortic valve into the aorta. And here's the aortic trunk, which then branches here to supply different areas of the body. And then it goes down into the descending aorta to supply the rest of the lower extremity of the body. So that's just a general kind of taking through of the heart. Now, our video is going to cover specifically the coronary arteries that usually aren't showed on many diagrams, and they're branching off before even the aortic trunk. So this is the aortic trunk, or the three main aortic branches here at the trunk. But you actually have branches off of coronary arteries coming off the aorta before this area. So you'll have two branches off, and you have the two primary coronary arteries and then their important branches, which we'll go over. So you have the left coronary artery, and that's going to branch here and go down from here. So this is the left coronary artery. And then you also have the right coronary artery, and it's going to do kind of similar, but it's going to be on the right side of the heart. And you may be thinking, well, this is the left side. So this, you would think over on the other side would be the left side, and over on the other side would be the right side. But remember that if we're looking at a patient, this is actually the left side and this is the right side. Imagine they're laying on a patient bed and you're looking at the patient. So really, if you put yourself in their eyes, this would be the left side and this would be the right side. Okay? So what we have, we're going to start with the left coronary artery. So this is the left coronary artery, this one on the left side, and you have two important branches. The first branch is going to be from the left coronary artery. You have a branch that goes down. It kind of goes down like this. Okay, so that's just, and I'm keeping this real simple because it helps not only me to understand it, but I'm hoping it helps you to understand some of these complex branching in the areas that they supply. So the first branch is the left, it's called the left anterior descending. The left anterior descending. And if you look at the picture, I'm drawing it kind of in relation to what it supplies. So this is going to supply the left ventricle and now this is important, the anterior septum. That means, so remember anterior and posterior. Anterior means the front, kind of towards the front of the body, and posterior is towards the back. So in this example, we're looking at the anterior. Remember, this is the anterior heart, right? So in this example, this blood vessel's moving on the anterior side. So you can imagine that this would supply, as far as this septum is concerned, this is going to supply, the left anterior descending artery is going to supply the left ventricle and the kind of the front area of the septum. In other words, it won't go all the way through. It can only supply through a certain depth of the septum. Okay? The next artery you're going to have is going to be called the circumflex. And that is a branch That's a branch off of the left coronary artery. And what happens in the circumflex is it actually branches off. It kind of goes around. So we're going into the back of the heart. The dotted area is showing the back of the heart. And I can show this actually in a better example. Here's a picture I've pre-drawn, and I'm not an artist whatsoever, as you can see. So this over here is the posterior heart. And I'm kind of taking you now. So we were at the branch over here. We were going through the left coronary artery. And we said that if it were to keep going and kind of wrap around the heart and then kind of curve a little bit even downward. And that's where we are right over here. So now imagine you're the patient and you flip over to your back. So now the left side is going to be actually what we're looking at. It's going to be the true left side of what we would think is the left. And this is the right over here. So the circumflex artery comes around over here and it kind of does like this, just to keep it simple. So the left circumflex artery, that's going to supply exactly kind of the areas that I said it was going through. Look, so it comes down. Let's go back to the anterior part over here. It comes back down and it kind of wraps around and then goes in the back of the heart. So what is this going to supply by looking at that? Well, you can see that the left circumflex artery will supply the lateral anterior left ventricle, right? Because that's where we are over in that section. And then it's also going to supply this posterior, the posterior left ventricle. Because see, it goes around to the back. So that's not too complex. So those are the two primary branches of the left coronary artery. Now let me clean up the picture a little bit and let's go back to, now we're going to jump. So this was the left one and I'm not going to draw all of it out. I'm just going to do like this. And then we have the right coronary artery. Now the right coronary artery goes down. It goes kind of over the right atrium. And then you have actually everyone says there's two important branches, but really I would say there is more like 3 or 4, which I'm going to go over some of the smaller ones, and I'll show you how they ask questions about these ones. So you have a branch early on off of the right coronary artery. Okay, so let's just remind you again, this is the left side, and if you have an anterior view of the heart, and this is the right. So early on in this branching, a branch off of the right coronary artery, you actually have a branch that kind of does like this. Okay, this is called the SA, and this name's perfect, the SA Nodal Branch. Well, what is that going to supply? Exactly what it's called, the SA, the Sinoatrial Node. Remember that the Sinoatrial Node is located in the right atrium, and this is what is your primary heart rate controller of the whole heart. So this is what sets the rhythm. Now, you can have problems where if the patient has some other way lower heart rate, that's, let's say, pathologically lower heart rate, you can imagine that there could be an issue with the SA node, and then other areas of the heart can set their own rhythm, but at their own specific pace. That's slower than the SA node, and that's where you can have certain cases of bradycardia in situations of SA nodal dysfunction. But anyways, that's besides the point. So this branch early on in the right coronary artery is called the SA nodal branch, and it supplies exactly what it's called, the SA node. Okay, and that's off the right coronary artery. Now the next one is going to be a branch called, so first of all, the right coronary artery keeps on going around, and just like the left coronary artery did, which then turned into the circumflex, this is going to go on to the back of the heart. And then, so I'm doing the dotted arrows, and that's, the dotted just means that it's in the back. Okay, just like the left coronary artery goes to the back of the heart, and that supplies the areas with its left circumflex branch. Okay, so now we're in the back. And first of all, before we go to the back, I want to say that there's a branch here that goes down and supplies this right ventricle. Just like the left anterior descending off the left coronary artery supplied the left ventricle and the anterior, but it also supplied, remember, the anterior 1/3 of the septum. The anterior, let's just make it simple, anterior septum. The right side from the right coronary artery is going to have a vessel called the marginal. Now, I'm only calling it marginal because there's different names. You can say acute marginal, you can say right marginal, either one is correct. And the reason it has the name acute, if you ever see acute, it's because when you look at the branching of this section, it's actually acute branching, which means it's just less than 90 degrees at that branch. So I may not have drawn it correctly here, but that's how it gets that name, acute marginal. But nonetheless, just memorize this is the right marginal coronary artery, or the marginal artery off the right coronary artery. And this is real simple. What is this going to supply? This is going to supply the right ventricle. Okay, so super simple. Now let me clean it up again because I know it gets a little messy. And let's say that this is the right coronary artery and this is going to be the marginal. And we're heading to the back. So let's jump back over to our picture over here. So we're turning this heart around. Okay, and when you turn it around, now the left side is over here and the right side's over here. So remember I said that the right coronary artery keeps on going towards the back. So now we're on the back of the heart. This is, so just imagine where we are in the heart. This is clearly the right atrium. This would be the right ventricle, just kind of a rough estimate. And then the left atrium and left ventricle. Okay? So you have this branch that keeps on going around the back of the heart, and it will branch. There's two branches here. Now, I've seen in a lot of sources that people like to say that the AV node, now remember the AV node just stands for atrioventricular. This is the area that kind of goes down. There's like the wall, obviously, in the septum, the area that goes down, and there's an AV nodal section that controls kind of how fast the impulse goes from the atria of the heart to the ventricle. Now, this vessel, this right coronary artery, has a little branch that supplies the AV node, and I bet you can guess what the name of it is. It's the AV nodal branch, or the AV nodal coronary artery. Basically, you just need to know it's literally called what it supplies. What does it supply? The AV nodal branch. Now, here's what I've seen in a lot of sources. I've seen in a lot of sources where people write that there's another branch below the AV nodal branch, and this branch is called so it's coming off of the right coronary artery going down. This branch is called the posterior descending, or you could also call it the posterior interventricular branch. So this is kind of going here, and it goes down the septum. Now remember I told you, let's go back over here. Remember I told you that there's a left coronary artery, right? And it goes down, and then there's a left anterior descending that supplies what does it supply? The left ventricle and the anterior septum. Remember I said that the surface, more closer to the surface when you're looking at a patient from the front, the anterior septum. In this example, this right coronary artery sends a branch off of it, and it's called the posterior descending coronary artery, or you could say the posterior interventricular coronary artery. And that is this branch here that's literally going right over the septum. But it's going over the septum from the back. So that tells you what it supplies. What does the posterior descending artery supply? It supplies the posterior. Notice that I'm emphasizing that, posterior septum. Okay? Now, I've seen sources that try to say that the posterior descending artery supplies the AV nodal branch. Well, maybe slightly, but really, if you want to be more correct, the AV nodal branch, which is a separate branch that's more superior, that's basically above the posterior descending artery, that is the one that supplies the AV node. But both of them are off the right coronary artery. So you can see there's a lot of ways that a test question could be phrased. You could say which of these coronary arteries supplies the AV node. Well, it may not even write AV nodal branch, or it may not even write posterior descending artery. It may not write any of them. It may just be right coronary artery, and that's the most correct because, of course, all of this is branches off of the right coronary artery. Okay. Now we're going to get to what the topic of this is that I wanted to get to, and this is really simple. Now that I've gone through all of the drawing out of the different sections of the heart, I want to show you what does coronary artery dominance mean? Coronary artery dominance. So now that you have a good knowledge of how the branches of the coronary arteries go around the heart and what they supply, this is real simple now. Coronary artery dominance just means it's basically, so it can be left or right dominance. Okay, that's the two, there can actually be one other one. It can be left or right dominance, and in really rare situations, you can have codominance. But I'll show you what that is, and it's extremely rare, so it's not often tested in questions and whatnot. So left or right dominance. So a left Okay, first of all, right dominance is what the majority of society is. Right dominance, about 80% of the total population is right dominant. All that means is that, remember I said that you have, here it is again, I'm just going to reinforce your knowledge. This is the left coronary artery, okay? And then you have the part that goes around the back, that's the circumflex. And then you have a right coronary artery, and it gives the SA nodal branch, and it gives the marginal, and then it goes around the back as well to eventually give the posterior descending artery and the AV nodal branch. Okay. In right dominant patients, which the majority of society is, now we're going to go over here to the other side, and this is now the heart turned around. So in this situation, this was right, left, and right. And this situation, it's back to normal. Now this is going to be left, this is going to be right. So we're jumping over, we're going back to the right coronary artery, and it has come to the back, it's made its way to the back, and here's the AV nodal branch, and then here's the posterior descending artery. Now, coronary artery dominance is that in the patients that are right dominant, which is the majority of patients, this artery is actually coming off of the right coronary artery. That's what right dominance means. So in right dominance, it's basically which artery the posterior descending artery is coming off of. I'm going to show you what I mean here. Okay, in this situation, now remember, you have a left coronary artery that is wrapped around and gives off the circumflex, right? That is then wrapped around, okay? So this is just kind of a simple of that. That's over on this side. Now, what you can have sometimes is that you can have this posterior descending artery is actually coming off of the circumflex, okay? Okay, guys, sorry if there was a little interruption in the video right there. I actually got a phone call and I didn't want it to show up on the video. So we're back to what we were talking about. And I had said that the right in coronary artery dominance, all it has to do is which of the coronary arteries the posterior descending artery is coming off of. Now, in a patient who is right dominant, which is the majority of people, 80% in society, the posterior descending artery, and remember what it supplies the posterior septum on the back of the heart, kind of going deep into the septum. That posterior part of the septum is supplied by the posterior descending artery. And in the majority of patients, in 80%, it's coming off of the right coronary artery, which is shown over here. Now, in about 10% or so of patients in left dominant coronary artery dominance, it's actually coming off of the circumflex. Okay, the left circumflex. And remember that the left circumflex supplied the lateral. Lateral just means kind of to the far to the side. So the lateral left ventricle, and then the back, and then the posterior. And then the posterior left ventricle. So that's what the circumflex normally supplies. But the left circumflex, in a left dominant, a coronary artery dominant patient, it will also give off, along with that, it'll also give off going like a branch, basically the PDA, instead of it being on the right side, it'll be on the left side. So then how this is set up in a question is they'll tell you that the patient is left dominant. Left dominant coronary, let's say coronary dominant. Coronary circulation. It doesn't matter how they write it. Basically, they're going to tell you they're left dominant. Okay, the patient is left dominant, and then they'll tell you, and patient has occlusion of the left circumflex. They could come right out and tell you that, or they could tell you they could give you the lead. Say the patient had a heart attack, and they'll give you the leads of that, which I'll go over in another video. We'll cover the leads and how to know which areas of the heart it is. So now they'll tell you then which parts of heart are damaged. Of heart will basically be ischemic, will go under ischemic infarction. So which parts of heart are damaged? That's kind of putting it in layman's term. Now, if the patient was right dominant, for coronary artery dominance, that means that, okay, the areas of the heart that would be damaged would be the lateral left ventricle and the and then the posterior left ventricle. But in a patient who's left dominant, it would be the lateral left ventricle and the posterior ventricle, just like it always is. But remember, there's an extra branch coming off of the left circumflex in a left dominant patient, and that is the posterior descending artery. So now, what does that area supply? Remember, I said that area supplies the posterior septum as well. So then, and they would probably put both of them. They would put what the left circumflex normally supplies, but then you would have to know that in a left dominant patient, the posterior descending artery is coming off of the, in this situation, it would be the right circumflex. And so, I'm sorry, left circumflex, excuse me, the left circumflex. And then you would have to know that because of that patient is left dominant, that it also is going to include the posterior septum would be damaged as well. So I hope this video helped. If this helped you in any sort of way, please like, subscribe, share the video. Make sure when you subscribe to the video, you hit the little bell icon that's next to it after you click the subscribe button. What that will do is let you know anytime a new video is coming out. If you have any video suggestions, you're welcome to leave them in the comment section. I've gotten a few emails from people I know just asking me to do certain videos, and they'll be coming out in the future. I will see you in another video. Bye, guys.